Head-to-toe exam on a medical patient. First of all, I want to look at the head to make sure that in my first general impression that there's no trauma, and it does seem to be atraumatic. So I'll move on with the assessment. I'm going to check Steve's pupils to make sure that they're equal and reactive to light. When I shine the light in the eye should constrict, and then when I remove the light away, the eye should dilate back to its original size. So you would do this in both eyes, and Steve's eyes are equal and reactive to light. A constricted pupil would be a sign of maybe an opioid overdose, like a morphine or a heroin. A dilated pupil would be a sign maybe of cocaine or an amphetamine. And then unequal pupils would be a sign of a head injury. So we don't want any of that, so Steve's in a good place. No head injuries. We'll move down to the neck, make sure his neck is soft and non-tender. Then I'm going to move to palpate the thyroid cartilage and to make sure that it is in the midline. A deviated trachea would be a sign of a pneumothorax. And then also to look, make sure Steve doesn't have any jugular vein distension, a sign of heart failure. Moving down to the chest, I'm going to palpate Steve's anterior chest wall. A patient having chest pain and their chest wall is tender to palpation is usually an indicator of a respiratory emergency. So just want to look at that, make sure that it's non-tender to palpation. There's no bruising or discoloration to the chest. And then I'm going to auscultate lung sounds up here at the apexes, make sure that they're clear, equal, and bilateral. And the same down at the bases, make sure that they're clear, equal, and bilateral. And they are present and good lung sounds, breath sounds. Next, we'll move to the abdomen. Palpate the abdomen to make sure that it's soft and non-tender in all four quadrants. I'm looking for masses, discoloration. A mass, a pulsating mass, may be a sign of a aortic aneurysm. So we want to palpate the abdomen, make sure that's soft and non-tender in all four quadrants. As we move down, I'm going to just make sure the pelvis is stable. Just push in, make sure the pelvis bones are stable, and start palpating the legs. I'm going to touch the legs all the way down to make sure that they're in equal temperature. That Steve can feel me touching his legs all the way down with good sensation, and that they're warm and they're dry and pink. As I get down to the ankles, I'm going to look for edema. Edema in the ankles is a sign of a right-sided heart failure, which Steve has no edema. And then I'm going to check dorsal pedal pulses. Make sure he has good distal circulation. Then CMS, circulation, motor, and sensory. Steve can move his extremities. He can feel me touching them. And then I'm going to do a capillary refill for circulation and also check dorsal pedal pulses while I'm there. So his lower extremities are good to go. I'm going to come up to his upper extremities and do the same. Make sure his skin is warm, pink, and dry. Check bilateral radial pulses. Do grips to rule out any type of stroke. And that concludes the head-to-toe exam. And Steve's in a good place. Alrighty.